Hello.
Hi, Gunther. How are you?
Good. Can we start with you introducing yourself?
Sure. My name is Arnab Mukherjea. I'm a professor of public health at California State University, East Bay. That's in the San Francisco Bay Area.
Perfect. And we are here at the meeting of the American Public Health Association. And the topic of this meeting is rebuilding trust in public health and science. So that already indicates that there is some loss of trust in science, and you have personally contributed to this debate. I believe you published in JMIR Infodemiology.
Yes.
Can you tell us a little bit about your work?
Yeah, so obviously the COVID pandemic taught us a lot about what works and what doesn't work, and in particular about how communities get their information. I think the one thing that we didn't quite appreciate as scholars, as health practitioners, is that we often think that people care about health as much as we do based on what we do for a living, whether it be providing services, doing research, etc. So I think the one thing that became apparent is that in the context of all the other priorities people have, health subconsciously may be a top priority, but for day-to-day survival, it may fall second, third, fifth, 10th. So I think one mistake that we made was we assumed that the importance that we placed on immediate health outcomes relative to economic opportunities, survival, etc., kids' education, I think we miscalculated how to frame the importance of screening, diagnosis, vaccination for COVID. The other thing that I think, again, we know academically is that, especially in the world that we live in, there's so many inputs of information. The web is just this wide expanse of information, misinformation, disinformation. It's hard to get an idea of what's out there, but we do know that communities often turn to those channels for immediate information, sometimes to confirm what they already believe, but other times just to find an answer. So in the work that I was able to contribute to that was published in your journal, we looked at the sources of misinformation around COVID, not only what is it, how to prevent it, how to treat it at that time, which wasn't very many ways, and then the role of vaccination, and found things that I knew were true just because of my membership in the community, things like WhatsApp, Signal, all of these various channels that I know all the uncles and aunties look for information, but I didn't quite appreciate how impactful what was being said on those channels were. So we decided to look at the role of those type of community-based channels on how information was being transmitted, which was very insightful because it often was disconnected from the scientific information that we needed to get out to communities in a really rapid way.
Mm-hmm. Yeah, and you said quite rightfully that consumers/patients don't always appreciate health to the degree that health professionals perhaps do. Plus, in the pandemic, I think the problem is we're also dealing with the health of others. Mm-hmm. And I believe, especially in the United States, is this big tension, was and still is this big tension between personal liberties and government intervention, like you mentioned, vaccination. Mm-hmm. And I think that was discussed yesterday in yesterday's keynote as well, that tension between personal liberties and protecting the public and what the role of the government and public health professionals is. So what did you learn particularly about vaccinations from that analysis?
So I think if you look at a very narrow argument that vaccine mandates, mask mandates for certain groups were interpreted as infringement of their liberties. At the same time, I think we did a poor job of saying that one person's liberties affected another person's health and well-being, right? We've known this, school vaccinations have been mandated since I've been young. For measles, for mumps, rubella, all of these things. And that is done not as an individual intervention, but a public health intervention. It allows all students to access education in a safe and equitable manner. So we've known this and it's worked. I think the way that the message was rolled out, and I understand that we were doing as best as we can with imperfect and incomplete information, but often when we are going to use the role of mandates or required policy, we have to be very sure that the evidence backs that claim. And I'm not quite sure we did that across the board. And secondly, to make the argument that there's no other plausible option but to revert to mandates, right? So public health has to be very careful with its what's called police power, which its ability to enact policies that compel people to do something as a matter of law. And up to the COVID pandemic, individual liberty and public health policies have coexisted relatively well. You didn't see, for instance, a seatbelt law didn't raise up a whole bunch of ire about personal liberties, et cetera. So something happened in the pandemic in which I think, whether we knew it or not, public health professionals in some jurisdictions were quick to adopt these mandates without either communicating the need to do it or whether to have the evidence backing the need to do that. And I think we learned a lot of lessons from the pandemic, and I think we want to be very careful about enacting that role that we have that should be used in very limited cases.
What do you think can we do as scientists to reinstate trust in science?
So I think what's happened is that the field of science scholarship research has divorced itself from the community. I don't, as a member of my community and as an academic and as a researcher and as a teacher, I have to make sure that I have credibility in the community realms. And that doesn't come with my degrees or how many papers I've published. Most communities don't care about that. So to that extent, I think researchers and practitioners have to do a better job of establishing that trust and that credibility, not in times of acute emergency, but on an ongoing basis. And I think that has been lost. One thing that often happens in academia is we publish our papers, they get indexed onto some, PubMed or something like that, but we don't share those findings with the community themselves. We expect somehow that they're going to do a Google search and see the greatest thing that we publish, but that's not how communities function. So we need to do a better job of public scholarship, especially when the data that we collect comes from those communities. We do the recruitment, we do the data collection, do the analysis. What we don't do is return back to those communities and say, this is what your input helped us find. And it can't be limited to academic spheres of dissemination. I understand that's what we're incentivized to do. That's how we advance in our careers. But we also have to put an equal emphasis on getting out to the faith-based institutions, the community forums to say, we want to tell you what we found, and we only found this because you participated.
Yeah, and JMIR Infodemiology is an open access journal, and I'm sure your decision to publish in an open access journal also has to do with those considerations, not to lock away content in the library power. What do you think is the role of open access or open science more broadly to reinstate trust?
So I think open access provides a level of accessibility that in the past was behind a paywall or institutional subscription. I would urge us as a community of scholars, publishers, academics, researchers, practitioners, to figure out a model in which, again, it doesn't stop at the publication, no matter who it's accessible to, because again, most communities are not doing a Google Scholar search. Mm-hmm. So how do we find a way to incentivize the public dissemination of that outside the scope of professionals? And I think this is an all hands on deck approach. Open access is a very important starting point, particularly because it gives people in developing countries who don't have the ability to access these very expensive subscription fees. So it's a wonderful starting point, and I know the international community has a lot to learn from what we've navigated to. But I hope we can figure out, when we publish an article, can we write a community brief? Can we put together a community fact sheet that accompanies that as a condition of publication, right? So it has the scholarly impact, but it also has the community impact for those who are not going to look to where you and I go to find information.
Yeah, that is an excellent idea. I mean, we as publisher obviously also do a lot of other things post-publication, knowledge translation activities, like, for example, the interview we are doing right now, or also visual abstracts, also to help with this knowledge translation into the communities. We post this on YouTube, and we're posting our other interviews on YouTube. So that's kind of our contribution. And when I actually started the Journal of Medical Internet Research 25 years ago, the decision to go open access had very much to do with that aspect, to make information patient accessible, to also kind of equalize the power structures.
Sure.
Do you have any final words or anything we haven't touched on?
No, I think that this is a wonderful opportunity, like you said, for us to, have a conversation rather than write it in a very academic, sophisticated way. I just hope that that this conversation allows for more thinking strategically and collaboratively about how we get this important information out there. Because there's so much, again, we have to combat so much mis and disinformation that we have to make sure that our end of the bargain is solid, it's rigorous, it's credible, and then take that out to combat what the other side is doing, whatever that other side is. So I very much appreciate you giving me this opportunity. I think the journal has been very good in getting information out in the social media space, which obviously traverses both the professional world and the community world. And I hope we can figure out collective ways to keep improving that impact and reach. And so I thank you for letting me have this conversation with you.
Thank you. Very well put. And I hope you keep publishing with us.
Absolutely.